afternoon. My name is Renee Hartman and I am the Senior Manager of Rehab Services at NMC Provita Abu Dhabi. In the following slides, I'll give you a brief introduction to our team and the services that we offer. Our Medical Director of Rehab Services is Dr. Ahmed Al-Tayer. He is also the Physical Medicine and Rehab Consultant. Alongside him is Dr. Hussam Tuma and Dr. Krishnan. They are both Physical Medicine and Rehab Specialists working in our outpatient units as well as our long-term care units. We have two senior managers, Ms. Renee Hartman, overseeing the Abu Dhabi sector, and Ms. Mabuse Mashigo, Senior Manager for the Al Ain sector. In our outpatient units, we have two managers, Sumana Hector for NMC Royal Hospital Abu Dhabi, and Ismail Sheikh, the manager at NMC Specialty Hospital in Al Ain. We have a team of physiotherapists, occupational therapists, and therapy assistants. We also have a manager for speech therapy services, Dr. Fatima Musa Ishaq, and she has a team of speech therapists working across Al Ain, Abu Dhabi, Ruwais, and Sharjah. We provide rehab services at the following NMC Provita entities. In Abu Dhabi, NMC Provita Abu Dhabi, we have our LTC unit. In NMC Royal Hospital, we have two long-term care units, inpatient services and outpatient services. We also provide home care services in Al Ain and Abu Dhabi. Our outpatient sector, Bahrain cluster, we have Bahrain Hospital, NMC Shahama, and NMC Karama, where we provide physiotherapy outpatient services. We also provide outpatient services at NMC Oman. In Al Ain, we have our long-term care unit at NMC Provita Al Ain. NMC Specialty Hospital in Al Ain, we have the long-term care unit, inpatients and outpatient services. In Ruwais, we have NMC Ruwais Hospital. We will provide inpatient and outpatient services. The services we offer at our NMC Provita facilities is physiotherapy, occupational therapy, and speech and language therapy. What is physiotherapy? It helps restore, maintain, or delay deterioration of movement and maximize function. What do we do? Manual therapy techniques and modalities to reduce pain, therapeutic exercise to build strength, flexibility, and mobility, techniques to correct muscle imbalances and postural alignment, maximize mobility and function, gait retraining, techniques to improve movement coordination and balance, therapeutic exercise programs to rehabilitate injury and the effects of disease or disability. What conditions do we treat? In our outpatient sector, we manage pain, back pain, neck pain, rotator cuff injuries, frozen shoulders, tennis elbows, sciatica, and any types of sports injuries. Neurological conditions such as spinal cord injuries, traumatic brain injuries, and CVAs, muscular dystrophies. Respiratory conditions, recurrent chest infections, pneumonias, chronic respiratory failure, patients that are on ventilators, who requires chest physiotherapy. In our inpatient units, we also provide physiotherapy to patients that had open heart surgery, such as coronary artery bypass surgeries. We also manage pediatric conditions, cerebral palsies, spinal muscular atrophies, and myopathies. Occupational therapy. They focus on helping people with a physical, sensory, or cognitive disability be as independent as possible in all areas of their lives. The primary goal of occupational therapy is to enable people to participate in the activities of everyday life. What do? They improve functional independence, postural and seating assessments, cognitive rehabilitation, improve focus and social skills, structure and routine development, hand function, fine motor control, desensitization programs. They fabricate their own splints on site. ADL skills training, activities of daily living such as eating, dressing, bathing, toileting. Assessment and recommendations for assistive devices, modifying your environment with accessible design and ergonomic solutions. Therapy programs for physical, cognitive, behavioral, or mental health problems. And they also do home safety assessments. What type of conditions do they treat? Neurological conditions such as CVIs, TBIs, spinal cord injuries. Pediatrics, mental health or behavioral problems, sensory processing disorders, learning problems, developmental delays, post-surgical conditions, and severe hand injuries. Speech therapy. Speech-language therapy serves individuals diagnosed or at risk for communication and swallowing disorders. What do? They manage language disorders, speech disorders, and swallowing disorders. Language disorders such as pediatric language delays and disorders, social or pragmatic language disorders, central auditory processing disorders, learning difficulties, disorders affecting metacognition, acquired language disorders in adults, apraxia in children and adults, speech disorders such as articulation, dysarthria, voice disorders, fluency disorders such as stuttering and clattering, language and speech disorders due to hearing impairment, including auditory verbal therapy. Swallowing disorders, feeding aversion, oromotor or sensory feeding disorders, dysphagia, assessments and therapeutic interventions. We also have our physical medicine and rehab specialists that works in the outpatient departments, and they provide procedures as well within the clinic. Our rehab programs, we categorized our patients into the following categories: post-acute rehab, slow stream rehab, transitional care, and long-term care. Post-acute rehab, or PAR as we know it, it is patients with moderate to severe functional limitations who may require intensive rehabilitation. For example, a patient who had an acute stroke or traumatic brain injury, or a patient with a spinal cord injury, or any other neuromuscular disorders. Patients should be able to tolerate at least 3 hours of intensive rehab per day, 5 days per week, which could be PT-OT and or SLP if the patient needs speech input. And this is normally a demand requirement. The approval is monthly, so the patient is with us on a very short-term basis, only 1 month approval. A maximum stay is 3 months. Our rehab consultant with the team will submit monthly reports for extension based on the patient's progress. Slow stream rehab. The patient does not fit the PAR category, but has the potential for rehab. So it's patients with functional limitations who may require rehab. For example, a patient with an acute stroke, hemiplegic, TBI, or a patient with a neuromuscular disorder. The level of intensity is not the same as PAR, so the team is not committed to 3 hours of rehab, but the patient is seen daily, 5 days per week, 1 to 2 hours per day. So we are not committed to the 3 hours of therapy per day. If the patient shows progress, the team will increase the intensity based on the patient's tolerance and level of participation. The approval is short-term as well. It's only 1 month. The maximum stay is 3 months. and the team with the rehab consultant will submit monthly reports for extension based on the patient's progress. Next category is transitional care. These patients transition home, so they are transferred either from an acute care facility to us with the intention of discharging the patient home, or they admitted from abroad, patients that comes in from Thailand or Germany. So the approval is only 1 month, and our goal is to discharge the patient home safely. They have the potential for rehab. They may have other comorbidities which may slow down their rehab. And normally during that first week of admission, we have a family MDT meeting because their stay is so short, and our goal is to make sure that they discharge home safely. The OTs will conduct a home access visit within the first 2 weeks of admission. Equipment needs will be identified by the occupational therapist. The requests are then submitted to Daman Insurance for approval. Extension is based either on their medical needs or rehab needs, and whether Daman will approve the extension. So they are with us only 1 month. Then we have our long-term care patients. They do not fit post-acute rehab or slow stream, and they are definitely not there as transitional. Their stay is a little bit longer. They're with us for a longer period of time, 3 months and more, but they do have the potential for rehab. So the approval is a LTC 1713. They are a simple case. They are non-ventilated. They may have a tracheostomy or not. They have functional goals, and they may be seen daily depending on their level of tolerance and participation. Their stay may be longer than 3 months depending on the insurance coverage, and we also submit monthly for extension. With all our rehab patients, we normally do monthly MDT goal planning meetings. The first MDT meeting is normally conducted within the first week of admission because their stay is short term. We normally work on a month-to-month basis, no more than 3 months. So we try to have the first family meeting within the first week of admission, where the team meets the family and the patient, and we establish goals and a plan of care. Each week, the team will meet with the rehab consultant to determine the outcomes and effectiveness of the plan and the next steps. The team will then have follow-up meetings with the patient and the family every 2 weeks. The MDT team is normally your doctor, physiotherapist, occupational therapist, speech and language therapist, a nurse as well. So we have the whole team. Our client services is also involved in these family meetings. With our MDT meetings, we do discharge planning meetings as well. Because their stay is short term, and not only with our rehab patients, but with our LTC patients as well, we normally meet 2 weeks prior to the end of the approval. So with our rehab patients, we normally know the approval is for 1 month only, and we try not to exceed the 3 months. So we plan ahead with the discharge. We make sure that the OT does an access visit, make sure that the home is safe for discharge. If any modifications needs to be done, they will give their recommendations to the family. They will also identify the needs for equipment such as a hospital bed, a hoist, a wheelchair, and we will submit a request to Daman and make sure, or hopefully we'll get the approval from the insurance for the equipment, and then we can prepare the patient and the family for a safe discharge home. Once the patient is discharged, he will continue with his rehab either at home under our home care services, or if it's a patient that can attend the outpatient unit, they will then continue with their rehab in our outpatient facilities. We have lots of activities happening at NMC Provita, especially with our OTs. Our goal is to improve their quality of life, to integrate our patients back into the communities. We've had a patient that wanted to go to the fish market and the fruit and veg market. We also have patients that goes to the mosque, the Grand Mosque. Our pediatric patients during the cooler months, we take them to the zoo. Or a few patients in Al Ain. This is in Al Ain, where you can see they've had music therapy and occupational therapy tabletop activities happening. This is in Al Ain. 4 patients went to the Al Ain Football Club. We've also had a few patients going to the cinema as well. So we try to integrate them, get them involved in the community as well. Thank you. And that is our rehab department in all units. If you have any questions, please contact the nearest team. Thank you. As a rehab department, we are also responsible for the training of manual handling and ergonomics. In the following slides, we will define what is manual handling, the body mechanics, how to do a risk assessment. We will also look at back care, give you a bit of advice, and look at posture. What is a good posture? The slides that will follow will then be ergonomics, where we define ergonomics, the risk factors associated with musculoskeletal disorders, and possible solutions, what we can do in our own workplace. Manual handling and back care. What is manual handling? It is any activity requiring the use of force exerted by a person to lift, push, pull, carry, or otherwise move, hold, or restrain any person, animal, or object. What is our policy on handling and movement? If a patient weighs between 1 and 14 kilograms, one person handling is still allowed, but preferably 2 persons. If a patient weighs between 15 and 20 kilograms, 2-person handling is allowed, but we would prefer if you could hoist the patient. If a patient weighs 21 kilograms and above, the mandatory use of a hoist is required. Principles of body mechanics. So we've learned about, or we will teach you about center of gravity and base of support. What is center of gravity? The point around which the weight of the object is evenly distributed and can be balanced. A load should always be positioned as close to your center of gravity as possible. Base of support. A person's feet provide the base of support in standing. If you close your feet, your base of support is small and your center of gravity falls outside the base of support, which makes you unstable. If you open your feet, you have a wide base of support and your center of gravity falls within the base of support, which gives you more stability. Which is better, to push or to pull? When we push, you use your thigh muscle. These are big muscles where when you pull, you tend to lean back and you cause a curvature at the back, which can cause back pain. Stay close to the object, whether it's a patient or an object. Keep the object close to you. Do not lean forward. Use both arms and tighten your stomach muscles. Never push or pull with a bent back. When you do a transfer, when you transfer a patient, or if you need to move an object from point A to point B, we use the acronym LIGHT. We do a quick risk assessment, load, individual, task, environment. Load, how much does the patient weigh? Or if it's an object, is it too heavy? Is it too bulky? Individual, am I trained? Do I know how to use this piece of equipment? Do I need help? Task, what is your task? Where are you going? I'm transferring my patient from the bed to the chair, or I'm moving this box from point A to point B. So know your task. Environment, do I have enough space? Is there enough lighting? Any slippery floors? Any loose cables? Okay, so do a quick risk assessment when you do your transfers. Load, individual, task, environment. Back care. I'm sure everyone has suffered back pain at one or other stage in time, and we will look at the leading causes. What are the leading causes of back pain? Poor posture, sitting for long periods at your desk, lifting heavy or bulky objects incorrectly. It is so easy just to bend over and pick up an object. Lifestyle behaviors, sitting in the couch, watching TV, falling asleep in that position. So these are all leading causes of back pain. What is a good posture? Minimal stress on the vertebral joints and supporting ligaments. Body segments balanced around the center of gravity. So in the previous slides, we spoke about the center of gravity. Okay, so what is a good posture? Your head is centered or chin level. Your shoulders are down and back, not rounded. It is down and back. Your abdominal muscles are tightened. These are your core muscles and they support your lower back. Your knees are straight and relaxed, and the feet are parallel and the weight are evenly balanced. Few tips that you can try. If you're on your feet all day, any prolonged standing, keep one foot on a step. Just raise your foot a little bit. That takes the pressure off the lower back. Maintain a good posture. When you sit, avoid slouching in your chair. Bend your hips and knees, not your back. Never twist and bend at the same time. Exercise your back regularly. Swimming, walking, cycling, these are good exercises. Strengthen your abdominal muscles. Change your position regularly and take breaks. Stand up and stretch. What are the benefits of exercise? Helps prevent heart disease, improves stamina, strengthens and tones. A healthy body equals a healthy mind. It helps prevent injury, improves quality of life, enhances flexibility, and controls weight. These are just some exercises that you can do for your upper back and your lower back. The cat and camel is a very good stretch, and you can feel your spine stretching, as well as your pelvic tilt and your extension exercises. Thank you. The following slides will be ergonomics. Ergonomics, the art and science of fitting the work to the person. What is ergonomics? It is the scientific study of human work. Ergonomic principles adapt work to a specific person by designing tasks and tools or equipment to fit the individual to prevent injuries to the musculoskeletal system. What is the benefits of ergonomics? Why do we need ergonomics? Reduction of work-related injuries, increase work productivity, increase work quality, increase morale, improve comfort, and decrease fatigue. Common risks: musculoskeletal disorders. These are injuries caused by sustained exposure to stresses or repetitive motion. They may affect muscles, tendons, ligaments, bones, circulation, or nerves. Examples could be carpal tunnel syndrome, tendinitis, back strain or sprain, thoracic outlet syndrome, and many others. Ergonomic risk factors, which can lead to musculoskeletal disorders, could be awkward posture, static loading or sustained exertion, contact stress, for example, resting your wrist on the desk edge while typing or using a mouse, excessive vibration, for example, workers outside using hand powered tools, repetition of the same motion for several hours per day, the length of tasks without taking breaks, insufficient rest time, and psychosocial and behavioral stresses. General signs and symptoms: numbness, burning sensation, pain, tingling, cramping, feeling stiffness, tightness in the joints and muscles, decreased range of motion, for example, in your wrist, deformity, decreased grip strength, and loss of function. If you experience any of these symptoms, you may want to request additional ergonomic assistance. Areas prone to injury. So these are people often working at a desk. In the picture, you will see the highlighted areas. These are also pressure points: your neck, your upper and lower back, hips and knees, shoulders, elbows, and wrist. Ergonomics as prevention. So an ergonomically deficient workplace may not cause immediate pain because the human body has a great capacity for adapting to a poorly designed workplace. For example, if you have a hot desk, you share the same desk, the same chair with 4 or 5 other people, and you just get used to the height of the desk or the height of the chair. Your body adapts to it. But in time, the compounding effect of workplace deficiencies, it will surpass the body's coping mechanisms, causing physical symptoms. You will then start to feel aches and pains, emotional stress, low productivity, and poor quality work. So how can we help ourselves? How do we minimize the risk? Review your work area or your desk station. Position equipment so that your body is in a comfortable and a neutral position most of the time while you are working. Don't place things so you have to reach, twist, or bend continuously. Place the computer monitor directly in front of you. The screen should be at least an arm length away. Keyboard holder should have wrist pads. Phone placements, we all do this. Do not tuck the phone between your ear and your shoulder while you're busy typing or doing something else. If you're on the phone a lot of the time, consider a headset. Listen to your body. If you cannot focus or often feel tired or uncomfortable, you are probably not working in a good position. The ideal typing position on your left and a typical desk typing posture that can increase muscle fatigue and injury risk. On the left, you can see the knees are slightly lower than the hips, so you've opened the angle of the hip. The keyboard is lower, almost on your lap. On the right, you will see the hips and knees are at 90 degrees. This can cause pressure on the lower back as well. And the keyboard is slightly high, which can cause pressure on the elbow and the wrist. Just some extra examples of good and bad posture. You'll see in figure 3, the way she sits in her chair, as well as the picture below. To minimize awkward postures, adjust your chair to achieve a neutral position. Keep trying, it's an ongoing process. Like I said in the previous slides, if you work at a hot desk or hot chair and 4 or 5 different people uses the same chair, You need to adjust the chair each time you're going to use it. If there's a chair that is malfunctioning, please report it or have it fixed. Use a lumbar cushion for additional support, or if the chair lacks adequate back support, or if the seat is too deep, or a rolled up towel. It just gives you that added support in your lower back. Remove armrests if they contribute to awkward postures. Use a footrest or a keyboard platform to help achieve a neutral position if necessary. If your chair has this function, you can raise the chair height a few inches, tilt the front downwards slightly at an 8 to 10 degree angle. You will see your knees are slightly lower than your hips. So you're opening up the hip angle. It takes the pressure off the back, and the legs will support some of the weight. However, it's not recommended if you have knee or foot problems, because the weight is supported by your knees and your feet or your ankles. Possible solutions. So what can we do? Avoid the repetition. Choose the right desktop. Choose the right chair. A well-ventilated area. Enough light and space. Take frequent mini breaks. The longer the uninterrupted duration of a task, the more potential for discomfort or injury. And get up, stretch, change positions. No one solution for all. People come in all shapes and sizes. What works for one person may or may not work for another. Ergonomics is a puzzle to be put together for each individual. What works today may or may not work later. We all change due to time and circumstances. So it's an ongoing problem, or it's a work in progress. You have to continuously adjust, make adjustments, and remind yourself of your posture, the way you sit, the way you stand. Individuals must take responsibility for their own ergonomic problems. Think about possible musculoskeletal disorders before you have discomfort. Don't wait for the pain to set in. Listen to your body, pay attention to those aches and pains. Identify barriers to solving the problem. Change work habits. These are just a few exercises that you can do at your desk, how to stretch your neck, your shoulders, your arms. Okay? These are good exercises that you can do at work. Be aware of ergonomic hazards. Okay, so be constantly aware of your back, how to take care of your back, what to avoid, and how to minimize the risks. If you have any questions, please feel free to contact any of our therapists. Thank you.